Marol Memorial Hospital.
Construction on our new emergency room has just been completed, and we're so excited to share it with you guys.
Right now, we're standing in our Level 1 trauma bay. This is where all ambulances arrive to deliver those Level 1 patients. Along with construction of our brand new emergency room, our staff has been hard at work making a brand new innovation.
Let's go inside and check it out.
The Triage Fit is our brand new innovation for tracking patients. The Triage Fit is similar to a Fitbit in that it's a bracelet that can track activity. Our Triage Fits are able to track heart rate, breathing rate, and location in the hospital that can be easily monitored by the nurses and doctors. This will allow nurses to track patients' vitals while they are waiting in the waiting room in order to prevent any medical emergencies. The Triage Fit also has the estimated wait time until being seen so that our patients will know roughly how long they will be waiting. Most importantly, the Triage Fit has 5 different colors that represent the different levels of triage. The red being level 1, pink being level 2, green level 3, blue level 4, and black level 5. When patients walk into our hospital, they will check in at the reception desk and fill out paperwork and detail the problem. Family members will only be allowed to go back with the patients, and here they will be checked for ID to make sure they are family.
Directly to the left of our waiting room are the 3 triage rooms. These rooms provide privacy for our patients as the nurses take their vitals, ask any questions, and give them a triage fit.
Here is the nurses' station. This is where our nurses will be able to track all of our patients. Not only can they track patients in the waiting room, but also throughout the entire emergency facility using the Triage Fit programming that is on the monitors seen in this clip.
After all of the construction, Marol Memorial was able to upgrade our exam rooms. Our exam rooms will be monitored by 3 nurses, 2 paramedics, and 3 doctors. We are now an emergency room equipped with 20 exam rooms. This will allow our staff to get our patients into and out of the emergency room as efficiently as possible.
Here is one of our exam rooms that a patient would use in order to be examined by one of our excellent ER doctors.
Outside each examination room are these flags. Each color corresponds to a different need of the room. Red means that they need to be admitted into the hospital. Green means that a nurse is needed for an IV. Yellow means an X-ray is needed. And blue means a doctor is needed. These flags make it easy to see what each room needs when looking down each hallway, and when the task is complete, can be pushed back, increasing our hospital efficiency.
One of the brand new components to Marol Memorial is our urgent care. This will be staffed with 1 family doctor, 1 NP, and 1 nurse. The new urgent care allows for our community to have a place to come for quick examinations. The ER has busy times that can make wait times excruciatingly long. The new urgent care will cut down on wait times significantly. Another new section of our ER is the Women's Center. Our Women's Center is staffed with 1 OBGYN, 1 nurse practitioner, and 1 nurse. Our Women's Center will be open 24/7 in order to provide examinations, consultations, and advice for women in our community.
This is an example of one of the rooms in the Women's Center. This room would be used for someone who is potentially staying a long period of time and could be giving birth soon. There are also examination rooms in the Women's Center that are very similar to the examination rooms in the other parts of the emergency room.
Our new trauma center will wrap up our new layout. Construction began after Marol Memorial was upgraded to a Level 1 trauma center. There are now 4 trauma rooms that can accommodate 8 patients and will be closely monitored by 4 nurses, along with the ER doctors on staff. These rooms are very large and right inside of our trauma bay so that paramedics and EMTs can easily access them, making the chances of saving our incoming patients even higher.
Here's an example of one of our trauma rooms. The bed is not present because that would be wheeled in from the ambulance or from the patient when they immediately get into the emergency room. There's large enough space for doctors and nurses to be working on the patient and easy entrance and exit into the room, making things more efficient. This is an area of a hospital with storage of extra beds that's easily accessible to nurses and doctors. This would be used during busy hours from 2 a.m. to 2 p.m. or if a large trauma case came in.
Some new additional resources that can be found at Marol Memorial. There will always be a neurologist and a cardiologist on staff who are available to come anywhere in the ER if they're needed. We also have the hospital pharmacy and the hospital radiology found right here, which gives us easy access to all of our staff so that All of our patients in the exam rooms, if they need x-rays, can easily get to radiology, and if they need medication, pharmacy can easily get it brought to the emergency room.
Changes in our emergency room also bring changes in shifts. After careful consideration and a lot of research, we have found that our emergency room can be most efficient if we have less shift turnover. This allows our staff to work with patients longer and see them through the emergency room process. Our plan is to have 4 teams that work on a 4 days on, 3 days off, 3 days on, 4 days off cycle. Let's look at the 2-week outline. All medical personnel on Team A will work days. They will work 4 days on, then 3 days off. When they are off, Team B will be working. This cycle continues for 2 weeks until pay starts over. Same goes for nights. This shift change does not require us to pay overtime due to the amount of time off. Marol Memorial has 2 12-hour shifts, 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. We will have 10 RNs, 0 PAs, 4 ER doctors, 1 neurologist, 1 cardiologist, 4 NPs, 0 EMTs, 2 paramedics, and 1 OBGYN in our hospital at all times. Let's go ahead and look at our budget. Our entire hospital, our budget comes out to $882,792. But there are definitely times when hospitals can be busier, specifically between the times of 2 a.m. to 2 p.m. With the remaining $117,208, we will be able to pay any overtime or on-call medical personnel. It's important to us at Marol Memorial that you understand how hard we've been working to make our ER run as efficiently as possible. So we are going to be giving you 2 example patients of people who could be walking through our ER. Let's start with patient 1. Patient 1 is a 30-year-old female who happens to be pregnant. She has a history of miscarriages and has come in with elevated blood pressure. She was recently diagnosed with gestational diabetes. She's having mild contractions and her blood pressure is elevated, and the baby's heart rate is 138 beats per minute. When this pregnant lady would first walk into our ER, she would walk in and check in at the reception desk, right around here. Immediately, one of our triage nurses would take her into the triage rooms right here, and they would take her vitals, which, as we said before, she has elevated blood pressure and the fetal heart rate's at 138. She would be given a level 2 triage fit band, which would be pink. From there, she would be taken to the Women's Center, which there's easy access through here, right into the Women's Center, so that there she would be examined by an OBGYN. The OBGYN would then decide whether she needs to be admitted into the hospital over here, or if she needs to be staying in the Women's Center for any other procedures, or if she can go home. An example of another patient who could come into our ER is our patient number 2. Patient number 2 is a 76-year-old man who complains of having hard toenails and is unable to cut them. He denies any break in his skin or signs of infection, and his vitals are normal. When the 76-year-old man would first arrive to our ER, he would walk in and check in at the receptionist. Then he would be taken by a triage nurse into one of our 3 triage rooms. There, his vitals would be taken and they would be found normal, like we said, and he would be given a triage fit band. In this case, it would be black because he is considered a level 5. He would then proceed to wait in the waiting room until a nurse would be able to direct him to the urgent care. Once he gets there, most likely a nurse practitioner or a PA would recommend him to a podiatrist.
And that concludes our tour of Marol Memorial Hospital.